My name is Tara, and the type of cancer I chose to talk about today is testicular cancer. I work in an STD clinic, and we tell our male patients who are in their 20s and 30s that they should do self-exams on their testicles every month. Testicular cancer is not necessarily painful. It can present with even a small pebble-sized bump, so if there is a bump that is felt, then you should go see a practitioner immediately. About 90% of all testicular cancers arise from germ cells in your testicles that clump together to form a mass or a tumor. There are two types of testicular cancer from germ cells: seminoma and non-seminoma cancer. Seminoma is slow-growing cancer, and it primarily affects people in their 40s and 50s, and then non-seminoma grows very rapidly, and it mainly affects people in their late teens, their 20s, and early 30s. There are 4 types of non-seminoma tumors, and each is named after a type of germ cell that makes up the tumor. So there's embryonal carcinoma, yolk sac carcinoma, choriocarcinoma, and teratoma. The tissues that are involved in testicular cancer are germ cells, and they're referred to as germ cell tumors. Germ cell tumors can start in several parts of the body. The testicles is the most common location, but they can also present in the abdomen near the spine, called the retroperitoneum. The risk factors are testicular cancer most commonly affects people aged 15 to 35. Another risk factor is a male who was born with undescended testicles. Testicular cancer is more common among non-Hispanic whites in the United States and Europe. If someone has a personal or family history, you're more likely to get testicular cancer, or if you have an inherited genetic condition such as Klinefelter syndrome, you might be at an increased risk. There's also infertility. Some factors that cause infertility could increase your rate of testicular cancer. Testicular cancer is rare. It only affects about 1 in 250 men in their lifetime, but it's still the most common cancer among assigned males at birth from ages 15 to 35. Treatment options for testicular cancer include chemotherapy, radiation therapy, and surgery. The surgeries that are offered are radical unequal orchiectomy, which is the removing of the testicle, or retroperitoneal lymph node dissection, the RPLND. The prognosis of testicular cancer is excellent. This form of cancer is treated successfully in more than 95% of cases, and even with people with unfavorable risk factors, have on average a 50% chance of being cured. The current research that's being done on testicular cancer is a high-dose chemotherapy followed by stem cell transplantation, as well as new chemotherapy schedules, and then some genetic studies as well. So the most common sign of testicular cancer is a painless bump in your testicle, but other symptoms could include a swelling or sudden fluid buildup in your scrotum, a lump or swelling in either testicle, a feeling of heaviness in your scrotum, a dull ache in your groin or lower abdomen, pain or discomfort in your scrotum or testicle, and a shrinking testicle or testicular atrophy.